5 Typical Signs of Generalized Anxiety Crisis. Hello and welcome to the Doubter Sod channel. Today's topic is fundamental importance for you to be aware of these signs that are typical of the generalized anxiety crisis. But just having the knowledge and awareness of these signs will make you feel a little calmer and treat at least some of these symptoms like that boring visit who goes to your house. That you never like to receive her, but inside you know she's fleeting, and soon she'll be leaving. It's always important to remember that if you are experiencing these symptoms frequently and they are affecting your quality of life, you need to seek medical help for proper diagnosis and treatment. Feeling of fear or panic. During an anxiety attack, it's common to feel an intense sense of fear or panic, even if there's no reason to justify it. You may feel threatened or in imminent danger, even if there is no real threat. Imagine the feeling of being in imminent danger, as if you were about to face an extremely dangerous situation or your life was at risk. It's as if the body enters a state of maximum alert, prepared to deal with a threat that is about to arrive. But in the real world, it doesn't exist. Rapid heartbeat. It's common for your heart to start beating fast and hard, as if it's skipping a beat. That feeling of a racing heart can be frightening, but it's a common reaction to anxiety. The feeling of racing heartbeats during an anxiety attack is when the heart starts beating faster and harder than normal. It's like he's skipping a beat or tapping out of control. Imagine feeling your heart beating so fast you can feel it in your chest, like you're running a marathon, even if you're just sitting around or doing everyday activities. This feeling can be quite uncomfortable and frightening, as it gives the impression that something is wrong with your heart. Although it is uncomfortable, it is important to know that, in most cases, the acceleration of the heartbeat during an anxiety attack does not pose a real danger to health. Wheezing or shortness of breath. Anxiety can also affect your breathing, causing you to breathe rapidly or feel like you can't get enough air. This can lead to dizziness, suffocation, and feeling short of breath. You may start breathing fast, as if you're panting, and this can make you feel like you're not getting enough air. During an anxiety attack, you may feel like you can't completely fill your lungs with air, or you may feel tightness in your chest that makes it difficult to take deep breaths. This feeling of shortness of breath can be quite uncomfortable and frightening. One technique that can help you deal with wheezing or feeling short of breath is to try to control your breathing. Breathe slowly, inhaling deeply through your nose and exhaling gently through your mouth. Focus on taking long, deep breaths to calm your body and normalize your breathing. Negative or catastrophizing thoughts. Anxiety can also lead to an avalanche of negative thoughts or excessive worries. You may start thinking about the worst possible scenario and feel an overwhelming feeling that something terrible is about to happen. During an anxiety episode, our minds can be flooded with negative thoughts about ourselves, others, and the future. We can imagine ourselves failing, being rejected, facing disastrous situations, or believing that something terrible is about to happen. These negative thoughts are characterized by exaggerating the bad side of things, ignoring positive possibilities, and expecting the worst outcome in any situation. They can be very intense and difficult to control, leading to a constant feeling of worry and distress. Recognizing these thought patterns is the first step in dealing with them. It is important to question the validity of these thoughts and seek evidence to challenge them. Ask yourself if there is any concrete evidence that things are really going to go wrong or if you are overreacting to the situation. Another helpful strategy is to replace negative thoughts with more realistic and positive thoughts. Try to find ways to look at the situation in a more balanced way and also consider the positive possibilities. Tremors or feeling weak. During an anxiety attack, you may experience tremors in your hands, legs, or even your entire body. Also, anxiety can cause a feeling of muscle weakness, as if your legs are going to give out at any moment. Tremors are caused by activation of the sympathetic nervous system, which is responsible for the body's fight or flight response. When we are anxious, this system is activated, resulting in the release of hormones such as adrenaline. These hormones can stimulate the muscles, leading to involuntary tremors. Tremors can vary in intensity from slight vibrations to more noticeable tremors. They can occur on the hands, legs, or even the whole body. These tremors are the body's natural response to stress and anxiety. In addition to tremors, anxiety can also cause a feeling of muscle weakness. This is because anxiety triggers the release of adrenaline, which can affect the muscles, making them tense and fatigued. This feeling of weakness is most common in the legs, where you may experience a feeling of instability or a feeling that your legs will not be able to support your weight. Once again, it's very valid learning relaxation techniques such as deep breathing, meditation or stretching exercises can help reduce tremors and feelings of muscle weakness during an anxiety attack. If these symptoms persist or if you have concerns about your health, it is always recommended to seek medical advice to rule out other possible causes and receive appropriate treatment. Your health, your life. Until later.